Hi Cheryl. We are here discussing our group presentation for the Manor House in Beckley, and we got the subject of depression. So I guess we'll just go down and give you briefly what we plan on doing. First, we'll start out with introducing ourselves. Of course, you know Melanie.
I'm Lisa.
I'm Kelly.
Yeah. So we'll just do a brief introduction, tell a little bit about ourselves, and then I will start the first section, which is on risk factors for depression in an older adult. I have like five risk factors to go over: bereavement, family history, medications, living alone, chronic medical illnesses. These I'll just elaborate a little bit. It's going to last about 5 minutes, and then.
And I think we're also going to discuss with I don't want to call them patients,
Right.
Residents.
with the residents about depression. Just,
Right.
talk to them about,
Yeah.
ask them if they have any of these, if anybody's experienced depression or all that before we start each individual part.
And you said depression has no age, so.
Right. When I start mine, I'm sort of going to go into a little bit about, we're talking to them as older adults, but depression can happen at any age to any person. It doesn't really necessarily
So we
have
don't
these.
feel like we're singling them
Right.
out.
We don't want them to feel like we're singling them out as older adults, so you're depressed.
So, and then mine will be, see that?
I don't know.
Oh, you're- Okay, mine is going to be the signs and symptoms of depression. So I'll discuss with them sadness, withdrawal, aches and pains, sleep disturbances, things like that can be risk or can be signs and symptoms of someone that's depressed. Maybe they don't know that they're depressed or getting into depression. So some things that they need to look for if they're kind of leaning towards maybe getting depressed, if they've had some of these risk factors that Melanie discusses with them.
And then I'm going to talk about the interventions for depression, and I'm going to talk about things like exercise, family and social support, reminisce, starting a new hobby, and a healthy diet, and just go over different things that they can do to not be depressed. And starting a new hobby is where we're going to incorporate our craft in, starting a new craft, and we're going to make a necklace.
Yeah, we decided instead of doing a game for depression to sort of give them to go along with their teaching plan, Kelly will be talking about how, trying to just interact with other people and socialize a little bit, that we would do something about a hobby. So we come up with crafting. So we're getting beads and necklaces, and we're going to let each person there make a necklace. So that will sort of incorporate all of it together. We're also going to do, since it's the day before Halloween, we decided to do some little goodie bags, some little Halloween bags, which we will have things and games, little things, little word search games and things like that in the bag that they can do as a hobby also.
And then after Kelly, we'll do a summary and a conclusion. That's when we'll lead into our craft.
Yep.
And I think that's it.
All right. Thank you.
Hope you like it.
Bye.